In our previous videos, we've actually talked a little bit about the anatomy of facial aging and some of the differences between an RT mini lift and a full facelift. Let's get a little bit more in depth in this. In an RT mini lift and full facelift, you are redraping the tissues. You're elevating the tissues and you're really targeting that underlying muscle layer. We talked about the anatomy of facial aging with muscles and tendons getting longer. So again, you cannot really rejuvenate the face and give patients that longevity that they need without targeting the underlying problem. Many types of mini lifts on the internet actually only target the skin. The problem with those type of mini lifts is that they'll probably last a few weeks to a few months and you're right back to where you were. In both cases, whether it be an RT mini lift or a full facelift, we are going to target that underlying muscle layer so that we can give you that 10, 12, 15-year longevity down the road. The difference between the two, as I've mentioned before, is in the neck. Let's say you've got a patient that just has some mild aging along the jawline and some mild aging along the neck. You can kind of think of that kind of like a hammock between two trees. Now, over time, that hammock is going to sag a little bit in the middle. If it's just sagged a little bit, you can kind of undo the hammock, tighten it up amongst the two trees, and the hammock will be taut again. That's what an RT mini lift does. We're basically dissecting along the edges with mild dissection in the middle and tightening everything up. However, if the hammock in the previous analogy actually has a hole in the middle of the hammock, you can tighten it up as much as you want from the edges. You're not going to be able to resuspend the hammock. You've got to actually put that hammock together in the middle. That's what a full facelift does. So in a full facelift, we actually dissect from ear to ear, all the way through the neck, redrape the full neck tissues, tighten the muscle layer in the neck, and if that's what's really necessary, we've got to target those layers because that's how you get the longevity. Every single woman who does this in the mirror really wants that taut 90-degree neck. So the big differences between an RT mini lift and a full facelift really is the anatomy that the patient brings to me. So this is why a full consultation is really necessary for us to really evaluate what's necessary and offer the best possible procedure for that patient. We offer free consultations. If you're interested in getting information about the RT mini lift or a full facelift, please don't hesitate to contact us.